6 Natural Treatments for Osteoarthritis. 1. DIY help for arthritis pain. Osteoarthritis, the most common form of arthritis, is a biomechanical and physiological disease. The cartilage that provides a buffer between bones breaks down and wears away, allowing the bones to rub and grind against each other. According to the American Academy of Orthopaedic Surgeons, AAOS, there are a few medications that can help you deal with osteoarthritis pain, as well as surgical treatments for people in extreme pain. But a number of natural remedies may help ease your pain. 2. Exercise gets you moving. Gentle weight training plus aerobic exercise is a great combination treatment for osteoarthritis that can strengthen the muscles around the affected joint, providing it with greater support and helping it stay healthy. Cartilage is like a sponge that needs exercise to bring nutrients into it to keep it healthy, says rheumatologist Gurjit S. Cayley, MD, Professor of Medicine and Chief of the Division of Rheumatology and Clinical Immunology at the University of Florida College of Medicine in Jacksonville. Exercise compresses and decompresses cartilage, helping nutrients flow into it. Drive. Cayley says, weight-bearing exercise can be as simple as walking or dancing, according to the National Institutes of Health. 3. Everyone into the pool. Guidelines from the American College of Rheumatology, ACR, on managing osteoarthritis recommend aquatic, or water-based, exercise. Some individuals may have too much pain to do land-based exercises, but aquatic exercises offer a way of exercising without putting too much stress on weight-bearing joints, Cayley says. Find a program that uses a heated pool and ease into the routine, starting in the shallow end without any equipment and then increasing your workout as your comfort level increases. The Arthritis Foundation recommends. Water-based exercise can also help older adults with osteoarthritis feel more confident about exercising, as well as improve mobility and the ability to perform daily tasks, according to research published in 2015 in the Journal of Geriatric Physical Therapy. 4. Get your weight under control. If you're overweight, you're putting a tremendous amount of pressure, stress, and strain on knees and hips, worsening osteoarthritis pain. The ACR guidelines emphasize losing weight to manage weight control, and those who are overweight is one thing you can do to improve symptoms and perhaps even slow progression, says Roy Altman, MD, a rheumatologist with UCLA Health and Professor Emeritus at UCLA's David Geffen School of Medicine. Even modest amounts of weight loss, 10 to 20 pounds, are often of benefit, says Drive. Altman, aim to eat a balanced diet, count calories, and exercise regularly. 5. Use ice or heat therapies. Lots of people swear by thermotherapy, the osteoarthritis treatment that uses heat or cold to relieve osteoarthritis pain. When acute pain occurs, icing may help, Cayley says. However, for chronic pain, many patients report relief with moist heat as well as topical over-the-counter anti-inflammatory creams. The ACR suggests asking your medical team when and how to best use hot and cold remedies. 6. Consider supplements. The combination of glucosamine and chondroitin may help with osteoarthritis. While the ACR in general doesn't recommend the use of either supplement alone, some studies have found that the combination can lead to some improvement of symptoms. In one study, published in July 2015 in Aging Clinical and Experimental Research, taking glucosamine and chondroitin for 12 weeks or longer appeared to give participants more ease of movement. In another, published in Annals of the Rheumatic Diseases in May 2015, taking the combination over the course of a year led to less joint pain, and taking it for 2 years led to less joint space narrowing than a placebo. Early evidence has shown that the natural vegetable extract called avocado soybean unsaponifiables, ASU, could be an effective osteoarthritis treatment that might even slow progression of the disease and reduce dependence on narcotic drugs, according to a research review published in the January 2015 issue of Cartilage.